Childhood cancer is fairly rare, but for those it affects, it is something that changes the rest of their lives. According to the American Cancer Society in 2015, cancer kills more children than any other disease in America. Over 1,200 people under the age of 15 are expected to die from the disease this year alone. More children are being diagnosed and cured than ever before, but the treatments cause changes that last a lifetime. My daughter was diagnosed with acute lymphoblastic leukemia when she was 2 years old. When she first started treatment, we went to the hospital twice a week. She had surgery to have a port put in her chest so she could get her medicine without so many needles. She has been through imaging tests, blood transfusions, intrathecal medications, which is an injection directly into the spinal fluid, bone marrow biopsies, and many other things to keep her healthy. She has been in remission for just over 2 years. Even after being in remission for so long, she just received her last treatment in November. We still go to the hospital every other month to do lab work and have a physical exam. This is not how I planned for my daughter to spend her time before elementary school. Childhood cancer will prey on anyone. It has no regard for religion, race, money, or social status. Every parent should be aware of anything that preys on our children. Throughout the speech, I will discuss how many children are diagnosed, survival rates, side effects of treatment, and follow-up care. I know that no one likes to think about children dying, but it is real, and awareness of the disease brings new treatment options. It is hard to think that it could happen to your child. Even though it's considered a rare occurrence, it is easy to compare the statistics to the size of a graduating class. The American Childhood Cancer Organization in 2014 states that roughly 13,400 kids are diagnosed with cancer each year, and about 1 in 300 boys and 1 in 333 girls will be diagnosed with some type of cancer before they're 20 years old. With today's treatment options, more than 80% of the children diagnosed will survive at least 5 years. Of course, that varies with the different types of cancers. However, death is not the only thing concerning with this disease. Some side effects are also more common than ever before. These include secondary cancers, heart and lung damage, infertility, chronic hepatitis, alterations in growth and development, and impaired cognitive and psychosocial impact. About 67% of survivors experience one or more of these side effects. These effects can occur any time after treatment. Because there's such a broad spectrum of when and what side effects can take place, follow-up care is recommended for the rest of the patient's life. Over half of childhood cancer survivors have had serious or crippling complications or have even died by the age of 50. Many of the follow-up visits include imaging procedures, endoscopies, and lab tests. Being considered a rare disease does not mean that it is not serious or that it does not deserve as much awareness as other diseases. Remember, this disease is killing our children more than any other. It makes a huge lifelong impact on the patient and even the people around them. Now you know how many children are diagnosed, what their chances of surviving are, some of the side effects of treatment, and about the lifelong, life-changing care that our children have to endure. I do not expect you to remember all of the statistics I've shared. I do want you to remember that awareness is the key to finding new treatment options. Remember that this is killing our children more than any other disease in America. Remember that this disease can affect anyone. Remember that remission is not the end of treatment. Remember that childhood cancer does not only affect its victims during childhood, it causes changes for them forever. Remember that even though this is considered a rare occurrence, every child affected matters. It's a hard subject to talk about, but it's harder knowing that this predator is out there.